The evidence leads me to the conclusion that the lockdown must be extended at this stage. But let me say this now. We are together making really significant progress in our efforts to get this virus under control. I have reported today a further reduction in the number of patients in intensive care. And yesterday, National Records of Scotland reported the first weekly decline in the number of registered deaths related to the virus since this outbreak began. All of that gives us real hope and real encouragement. But we also know that progress remains fragile. Our estimates suggest that there are still significant numbers of people in Scotland infected with this virus. And we're not yet confident that the all-important R number is comfortably below 1, and I've explained and set out before why it is so important to get it and keep it comfortably below 1.
Scotland may slightly ease lockdown to allow more daily exercise. Thin Lips has disclosed she could agree to the slight easing of Scotland's lockdown from Monday, but has rejected any significant relaxation of the rules. And when this 3 weeks comes to a close, are we going to do the same thing again and again and again? Because, from what I can tell, you're realistically just delaying the inevitable. Going by the very things these people themselves have said on many occasions when they refer to the so-called scientific advice and the scientific experts, such as mentioned there. It seems that if a bulk of the population hasn't already had it, they're in time going to get it anyway. That combined with the fact that barely anybody will see the more serious side of this so-called deadly pandemic, I really don't understand why we're all locked indoors, especially when some are allowed to roll around freely under the guise of essential workers. Nonetheless, she said there were concerns about public unrest in Scotland if Boris Johnson decided to relax England's lockdown rules more quickly. Now I've got about 15 tabs open, so I'm not going to waste time trying to find the additional information required to this point, but I'm sure if you've kept up for any length of time with the news, you'll know what I'm talking about, and that is that about 3-4 weeks ago, there was talk of Westminster extending their lockdown, and Beta Blackford in particular, but the SNP as a whole, were talking about, around about the same time after Westminster announced this, or rumours started spreading, that they were going to ease the lockdown. Westminster say last week, or some point last week, that there was talk of easing the lockdown. Then the SNP decide to do the polar opposite and extend the lockdown. And of course we get the charades and the bogus claims of progress being made by the SNP, taking the credit as per usual, when the reality of the matter is it really just looks like childish, pathetic games of doing the exact opposite of what Westminster intend to do. However, I missed this paragraph, sorry. Thin Lips said on Thursday that the only relaxation she would consider would be allowing people to exercise outdoor more than once a day from next week, but only if the scientific advice justified it. What scientific advice, exactly? Because it doesn't sound to me as if all scientific advice has been taken into consideration. All scientific advice has been put on the table to look at and come to the conclusion yourself. No, it's a hand-picked scientists, from what I can gather. And the reality of the matter is, what scientific advice is going to justify going out once a day? What scientific advice would possibly come to that conclusion that it's safe to go out more than once a day, when this same scientific advice is trying to imply that going out at all and breaching these so-called rules and guidelines could result in more deaths? I understand how there's a serious risk of going out and breaching these rules for whatever reason, but they don't seem to apply when it's an essential journey, or whatever it may be. Sturgeon said that the Prime Minister was due to host a teleconference with the leaders of devolved nations later on Thursday, following criticism from both Edinburgh and Cardiff that he failed to consult them about his plans to relax the lockdown from Monday. There were signs on Thursday that Downing Street was drawing back on reports overnight attributed to UK government sources that the Prime Minister would support greater outdoor activities. Thin Lips said her government was constantly talking to Police Scotland about public order. The force has said its data shows a very high level of compliance with the strict lockdown regulations, but by late April, 78 people had been arrested and there was more than 7,800 alleged breaches of the lockdown. Breaches of the lockdown. It's just ridiculous. Issues around enforcement are much more relevant matters because we've always been aware, as these messages over time become more nuanced, then the issues around enforcement become potentially much more difficult, said Parma Thinlips. Adding, she was opposed to any significant easing of the lockdown rules and warned against the government's devolved nations being pressurised into adopting lighter regulations before it was safe to do so. She said it's seen that Scotland's current rate of community transmission, the so-called R number, was hovering around 1. She said Scotland was still a few weeks behind England in the coronavirus infection curve. That needed to be far lower before the regulations were greatly eased. Meanwhile, of course, 8,000, as I've covered before, briefly, 8,000 are still arriving in Scotland, roughly. Could be more, could be less at this point, but the point remains the same. They're not being tested. And I asked the question, and I'll ask it again. How many of that 8,000 are migrants? Because I do not believe that they're all holidaymakers. I don't believe they're all Scots. There's no way in hell they're all holidaymakers. How many migrants are entering Scotland? But disregarding that, let's just leave that to one side for another day. Why are people on planes entering Scottish airports? Why are our borders still open? Why will those words not leave the thin-lipped mouth? Because she can't be quoted at any point as saying that the borders need to be shut, because that's against Thin Lips and her little bow-cut-headed mantra. We have 1,811 people apparently have died in Scotland, and all of them, of course, are attributed to the coronavirus. How many of them are presumed to be because of the coronavirus? 23,000 in 2017/18, but 1,811 in Scotland apparently, with over 1,000 of these being in care homes. Now, of course, how many of this 1,811 are presumed to be because of coronavirus, and how many of them died of other things while supposedly having said coronavirus? We will never know because they've deliberately flubbed the statistics and nobody bats an eye at that. So it goes on to say here in another article that Scotland's care home COVID-19 non-existent crisis is not a crisis. A crisis suggests something out with your control. The borders are open. And the fact remains the same. As I said in the last video regarding this, it's now on Skye, the Isle of Skye. How did it get to the Isle of Skye? What progress has been made by the Scottish Government, and why do people continuously brown-nose the SNP? Because as far as I can tell, they are fucking useless. 6th resident dies in care home on Scottish Island. A 6th resident has died from coronavirus in a care home on Skye, the home operator has said. A little back and forth between two people on my Facebook. Obviously I blurred out their names, but it's really just this bit here. If you look at the fact they aren't even requiring a positive test or symptoms in some cases to put COVID-19 in the death certificate, and that still less people have died overall compared to previous years, but we aren't supposed to go out. Businesses are being destroyed, people aren't getting the operations they need, the list goes on. If 98% will recover without problems, even if they need further treatment, why are we on house arrest? Quarantine is for the sick. The woman replies, I find it all a bit bizarre. I heard appendix ops were down. Surely people aren't afraid of going to A&E, as apparently it's quieter. Are people suffering? I've seen the disturbing stuff too, and I don't like it. Now, the problem with that issue relating to people being afraid to go to A&E, apparently, it was the government and the media themselves that put people off the idea when this thing all started. They put people off going to GP services, they put people off the idea of going to hospital, and now when the death rate starts to spike because people are dying for other reasons since this lockdown started, they're now trying to flip the place of blame onto the public and make it appear as if the death rate that is increasing is because of people's fears of going to the hospital. So they come out with their shitey little adverts to try and entice people to go to the hospital if there's something seriously the matter with them. They weren't saying that at the fucking time though, were they? Pardon my French. Anyway, any so-called non-essential operations are being cancelled. I have a family member, he was due a cancer op, and they postponed it. And I think they are afraid to go to A&E. People are suffering, especially in nursing homes. It's been reported that their meds are being taken away, and DNR forms being given to family members. But this is happening to people who are classed as vulnerable due to illness too. There are loads of testimonies coming out. What stuff did you see? Meds taken away, that's pretty heavy. And it says at the bottom here, even though the screen's a bit cut out, I saw a message from a lady. She said her daughter came home in tears from the care home she works in, because even people with diabetes have had their meds stopped. She was told everyone has been put on the pathway to death, and in brackets my name for it. Well, she's not far off the mark. As it says here in articles dating back to 2015 time, that the elderly will face NHS discrimination under new UN death targets. Elderly people will be treated like second-class citizens and denied medical care under new targets which give priority to saving the lives of young people. A couple more articles on the subject before I go down that one. UN death targets will mean reduced healthcare for elderly. And of course, Breitbart News also covered this at the time. UN demands NHS ignore the elderly and treat the young. So it says here, just briefly through this, that the NHS could lead to discrimination against the over 70s to meet highly unethical UN health targets which seek to reduce premature deaths in younger people. Under the proposed Sustainable Development Goals, UN member states will be given targets to cut the number of deaths from diseases like cancer, strokes, etc., diabetes, dementia, by 1/3 by 2030. The target will inevitably reinforce the ageist bias that pervades many aspects of health and care decision making. If adopted, this UN target could lead to institutionalised discrimination against older people in healthcare, both here in the UK and globally. If the target was around 42,000 lives would be saved. If the target was met, around 42,000 lives would be saved each year for the under 70s. However, if older people were included in the target, an extra 130,000 lives would be saved. The Sustainable Development Goals, which are due to come into effect later this year, replace the Millennium Development Goals, which ran up to 2015 and include ambitions for non-existent man-made climate change, healthcare, communism and policy. See articles such as this, Thin Lips is on a collision course with Johnson and there's no doubt who Scots trust. It makes me want to fucking boke.